One.
Hi, my name is Jess. I'm a Maryville nurse practitioner student, and today I'm going to be doing an exam on the lungs, cardiac, and peripheral vascular system. This is my husband, Andrew, and he's going to be helping me out today.
I, Andrew, voluntarily give Maryville University permission to record my image and/or voice and grant Maryville University to all rights to use this recording in any medium for educational or other purposes that support the mission of the university. I understand the following information will be gathered by Maryville University student as part of a course assignment. I give my express consent for this information gathering and physical assessment to be filmed and posted in the student's course shell for access by faculty and students at Maryville University. I further acknowledge that since the recording is for educational purposes only and the information is not meant to be diagnostic, therefore, Maryville University, the faculty, staff, and students are not considered liable. The recording will be deleted by the student and any of their devices as soon as it's been reviewed and graded by the instructor.
All right. So the first thing I would do is just walk in and note his rate, depth, and rhythm of breathing. Just noting that he doesn't look to be in respiratory distress. I'm not seeing any signs of retraction or accessory muscle use. No signs of cyanosis in his lips, and everything looks to be normal at this point. I'll come in and I'll start by palpation. Just noting any firmness that I feel, any tenderness,
No.
Any masses. I'm noting that there's no deformities. The lateral diameter seems to be bigger than the anterior posterior diameter, which is a normal finding. I'm going to start here. Can you say 99 for me?
99. 99.
Good. And that's tactile firmness, and that's used just to see if there's any consolidation. I might feel a little difference. Okay, again, no masses, no tenderness, no firmness when he's breathing. You can say 99.
99. 99.
Good.
99.
And what I'm feeling there is that the vibrations are equal on both sides, which is a normal finding. I'm going to do thoracic expansion. Go ahead and take a deep breath. Good. Right here, my hands were midline, and I saw as he breathed in, my thumbs went out symmetrically, which is a good finding. And next, I'm going to do percussion, avoiding bony prominences and listening for sounds of resonance. Good. So next, I'm going to do the diaphragmatic excursion. I'm going to have you take a deep breath in. Hold. All right, good. Good. Breathe normal. So I had him breathe in, and I percuss down until the sounds of dullness reach resonance. So breathe, and then exhale all your air out, and hold. All right, good. So what I did there is I percussed up until the resonance met dullness again. I would have had a mark here, the first one, and what I would see is that there was about a 3 to 5 centimeter movement there, which would be a normal finding. And I would do the same thing on the other side and expect it to be about the same bilaterally. Next, I'm going to move back to the front side, percussing again over the areas, noting normal resonance, avoiding the heart where it would be more of a dull sound, ribs where that would again be a dull sound. All right, good. So that was a lot of areas of resonance, which is a normal finding. Next, I'm going to move on to auscultation. We're listening for clear lung sounds. I'm going to start here, breathe. Good. Those nice bronchial sounds. Okay. Deep breath. Good. Deep breath. Good. Good. Nice vesicular sounds. Good. And on the sides. Good. So the lung sounds were nice and clear. I didn't notice any crackles, no wheezing. Then I'm going to move on to the back. Deep breath. Good. 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 So next thing I'm going to do is assess for bronchophony, which is where I'm going to have him say 99 again. And see what I find. I'm going to say 99.
99.
Again.
99. 99.
Good.
99.
All right. Good.
99. 99.
Good. And what I noticed there is that the sound was pretty muffled and inaudible, not something I could distinctly hear, and that's a normal finding. So if I could, if the E's became A sounds, then that would be equiphony. And then if I you know, if I felt that was a positive sign, I could have him whisper and see if I hear that as well, which would be pectoral lobe, which would not be, you know, might be an indication of some kind of pathology where there's consolidation or something that was causing the sound to be transmitted. Next, I'm going to move on to the cardiac system. I'm just going to face front. Again, looking, noticing for any signs of like pulsatory mass, any scarring maybe from a surgery. Okay, looking at the jugular venous distension. I'm not noticing any. I'm going to have you lie back. Again, noticing any kind of carotid pulse. No jugular venous distension is noted. It'd be like in this area. Good. Check the carotid. One at a time. Good. Just listen. For any bruise with the bell. Good. Good. So that sounds good. No bruise were noted. Just gonna palpate. Good. No crepitus. It's good. I'm gonna go down here to the 5th intercostal space, mid-clavicular line on the left side. This is the point where I should be able to feel a nice pulse matched up with the carotid. Very good. All right. There's not really any areas to percuss. I could try to figure out the size of the heart if it's enlarged by percussing, but that's not really used anymore. I'd probably do an x-ray to get an accurate reading. I can also tell by that the heart is in the 5th, in that point of maximal impulse, that would be a normal finding. So next I'm going to move on to auscultation again, using my diaphragm first. Listening to all the areas of the heart, or for heart sounds. Looking for even, rate and rhythm. Okay, that was the aorta on the right second intercostal space, right sternal border. And the pulmonic, left side, second intercostal space, left sternal border. And down to the third intercostal space for Erb's point. Between the 4th and 5th for the tricuspid, and down here to the 5th intercostal space, mid-clavicular line on the left side for the mitral area. Good. So I would go back through and listen to all that again using my bell, just to see if I heard any extra heart sounds, any murmurs. What I am going to have you do is I'm going to be turning to the left side. Good. And we're listening at that apex again with my bell for any signs of mitral stenosis. Yeah, it sounds good. All right, I'm going to turn back over. I'm going to start with the peripheral vascular system. Again, noticing the abdominal aorta. A nice pulse here, about 2 finger widths. This is a normal finding. Just going to come up here and check axillary nodes. Okay, good. Check the epitrochlear. Okay. In there. Checking the brachial pulses. Relax. Good. Radial pulses. Good. I could check the femoral pulse and his inguinal nodes. It's a little harder to do with the clothes on, so I'm going to leave that for now. We go to the palpatio. Nice pulses. And when I get down here to his legs, I'm just noticing for any signs of peripheral vascular disease. He has a good amount of hair, normal coloring, no edema is noted. It's really good. Good temperature. I'm going to come down here to his his pedal pulses down here. Good. Then back to the posterior tibial pulses. Good. So one thing I am going to check is the Allen test. If I can have you squeeze your hand 5 times, and I should see the color kind of drain away. Good. And then release the ulnar. And good. So all the color went back, so the ulnar artery is patent. Right? And next thing I'm going to have you do is go ahead and sit up. One more thing I'm going to check now that you're in this position. And using my diaphragm. And again, at the apex of the heart, lean a little bit forward and take a deep breath. Hold it. Good. So there's just listening for any signs of aortic stenosis. So, all right, that concludes our exam. Thank you.